Garlic has been recognized for its various health benefits, including potential antibacterial, antifungal, and anti-inflammatory properties. However, it's important to note that while garlic may offer certain health advantages, its use as a remedy for specific skin issues, like eczema and skin fungus, should be approached with caution. Always consult with a healthcare professional before using garlic or any other natural remedy, especially for skin conditions. Potential benefits of garlic for skin health. Antibacterial properties. Allicin, a compound found in garlic, has demonstrated antibacterial properties. This may be beneficial for addressing certain bacterial skin infections. Antifungal properties. Garlic also contains antifungal properties that may be useful against fungal infections. Some people apply crushed garlic or garlic oil topically to address skin fungus issues. Anti-inflammatory effects. Allicin and other compounds in garlic have anti-inflammatory properties, which may help alleviate inflammation associated with various skin conditions. Rich in antioxidants. Garlic is rich in antioxidants, which can help protect the skin from oxidative stress and support overall skin health. Wound healing. Garlic has been traditionally used for wound healing due to its antimicrobial properties. Using garlic for skin issues. Garlic cloves or garlic oil. Crush a garlic clove and apply it directly to the affected area. Alternatively, garlic oil can be used. Ensure it's diluted with a carrier oil to prevent skin irritation. Garlic paste. Make a paste by crushing garlic and mixing it with a small amount of water or aloe vera gel. Apply the paste to the affected area, but be cautious about potential skin irritation. Garlic infused oil. Prepare garlic infused oil by mixing crushed garlic with a carrier oil, like olive or coconut oil. Allow it to infuse for a few days, then strain the garlic and use the oil topically. Cautions and considerations. Skin sensitivity. Garlic can be harsh on the skin and cause irritation in some individuals. Always perform a patch test on a small area before applying it to larger skin areas. Avoid open wounds. Avoid applying garlic to open wounds, as it may cause further irritation. Consult a healthcare professional. Consult with a healthcare professional, especially if you have pre-existing skin conditions, or if you're considering using garlic for more serious skin issues. Discontinue use if irritation occurs. If you experience any adverse reactions, such as redness, itching, or a burning sensation, discontinue use and seek medical advice. Garlic supplements. While garlic supplements are available, using fresh garlic may be more effective for topical applications. If considering garlic supplements for internal use, consult with a healthcare professional. It's crucial to approach the use of garlic for skin issues with caution, especially if you have sensitive skin or existing skin conditions. Consulting with a healthcare professional can help determine the most appropriate course of action based on your individual health and skin needs. Using garlic for eczema or skin fungus should be done with caution, and it's important to perform a patch test first to check for any adverse reactions. Here are some guidelines for using garlic for these conditions. Garlic for eczema. Garlic oil application. Crush garlic cloves and infuse them in a carrier oil like olive oil or coconut oil. Allow it to sit for a few days, then strain the garlic. Apply the garlic-infused oil to the affected area. Garlic paste. Create a paste by mixing crushed garlic with a small amount of water or aloe vera gel. Apply the paste to the affected skin, but be cautious of potential skin irritation. Frequency. Use garlic topically for eczema once a day initially. If your skin responds well without irritation, you may gradually increase to twice a day. Monitor your skin for any signs of irritation. Garlic for skin fungus. Crushed garlic. Crush a few garlic cloves and apply the crushed garlic directly to the affected area with a clean cotton ball or gauze. Garlic oil. Apply garlic-infused oil to the affected skin, Make sure to dilute the garlic oil with a carrier oil to avoid skin irritation. Frequency. Start by applying garlic once a day and monitor your skin's response. If there is no irritation, you may increase the frequency to twice a day. Patch test. Perform a patch test. Before applying garlic to larger areas, perform a patch test on a small, inconspicuous area of your skin. Apply a small amount of the prepared garlic mixture and wait for 24 to 48 hours to check for any adverse reactions. Cautions and considerations. Skin sensitivity. Garlic can be harsh on the skin and may cause irritation. If you experience redness, itching, or a burning sensation, discontinue use. Avoid open wounds. Avoid applying garlic to open wounds or broken skin, as it may cause further irritation. Consult a healthcare professional. If you have pre-existing skin conditions, consult with a healthcare professional before using garlic for eczema or skin fungus. Individual response. Responses to garlic can vary among individuals. What works for one person may not work the same way for another. General recommendations. Hydrate the skin. Keep the affected skin hydrated by using a suitable moisturizer alongside the garlic treatment. Monitor progress. Monitor your skin's response to the garlic treatment. If you notice improvement, you can continue. If there's no improvement, or if irritation occurs, discontinue use and seek medical advice. It's crucial to approach the use of garlic for skin conditions cautiously. If you have concerns or if your skin condition persists, consult with a healthcare professional for personalized advice and guidance.